arthroplasty or knee replacement surgery. Lots of different options that are out there. Before we get to knee surgery, just like we've talked about, we always want to exhaust those non-operative options. So optimizing your weight so we can decrease that joint reactive force and that pressure that's on the knee. That's a super excellent way to start. Low impact exercise, so cycling, elliptical machine, swimming, all better than high energy exercise. But staying strong is very, very important. If we need to do things like anti-inflammatories, we can take anti-inflammatories like Advil, Aleve, Celebrex. There's lots of different options in terms of anti-inflammatories. We can do prescription strength. You can do over the counter. If we needed an anti-inflammatory inside of the knee, we can do steroid injections. We can also do lubricating injections, which is hyaluronic acid. There are options for things like PRP and stem cells. Not most of those in the knee are not approved by insurance companies, but we can use those as options if we're trying to avoid having a knee replacement. Ultimately, knee replacement surgery, we go in, we remove all of the arthritis. Arthritis is the damaged cartilage inside the knee. It's cartilage on the femur, cartilage on the tibia, and cartilage behind the kneecap that's worn down. And when it's worn down, you hear people talk about bone-on-bone arthritis. We develop bone spurs in that region, and we go in and we actually use implants to replace that cartilage. So we will remove the cartilage. We use special jigs that line up so that we can cut the bone. We oftentimes even use robots so that we can have our alignment and have our cuts be exactly where we want them to be. Then we place cobalt chrome and highly cross-linked medical grade plastic inside the knee. Sometimes we use some bone cement to secure it. Sometimes we are able to press fit things in place, and then we get you up, we get you moving, and we get things going. Typically, the pain from the arthritis in the knee is gone when you wake up from surgery, but we've got to get you moving. Hip and knee replacement surgeries, super important that we push hard with physical therapy, that we follow that postoperative protocol, and that we keep moving forward so that we can get to be as good as we can be. Most people will use a walker for anywhere from a week to 2 weeks. There's no hard and fast rules about how long you've got to use the walker. You can transition to a cane when you're ready, and then you can transition off the cane whenever you and the physical therapist have worked that out. Most patients will come see me at 2 weeks, 6 weeks, and 3 months. And hopefully by the time we're out to 3 months, we're feeling 90+% in that knee. But for some patients, it can be quite variable. It can take 6 months to even up to a year to finally feel like your knee is your knee. But total knee arthroplasty, it can be a life changer if we need it. We'll do everything we can to avoid it. But if that's what's for you, we'll be happy to take care of it.